Welcome to It's All in Your Head, presented by Swingle and Associates in Vancouver. Today we're going to discuss the treatment of alcoholism and other addictions. And the star of our show heads up a clinic that offers completely natural, drug-free treatment for these kinds of issues. For 7 years, he lectured at a little school you may have heard of called Harvard. Prior to that, he chaired the Faculty of Child Psychology at the University of Ottawa and was clinical supervisor there for 10 years, ending in 1997. And since then, he's been here in Vancouver, is one of the leaders in biofeedback and neurotherapy, a safe, medically certified treatment to a wide range of conditions that originate in your head. Good morning, Dr. Swingle.
Good morning.
Today we're going to cover what biofeedback neurotherapy is and how it works. We'll find out if alcoholism is environmental, social, or perhaps hereditary. You'll also learn why it's nearly impossible to treat an alcoholic from a bar stool. The role of organizations that AA play in a person's recovery, and we'll even touch on drug addictions like cocaine, marijuana, heroin, gambling addictions, sex addictions.
Yes.
After all these issues and all these discussions we've had about the book. The book is finally here, and it's a nice-looking book called Biofeedback for the Brain, How Neurotherapy Effectively Treats Depression, ADHD, Autism, and More. Congratulations.
Thank you very much.
How long has this been going on? It's been going on for a long time.
Yeah, the books that you write take about 7 years from the time that you get the idea to the time that you are holding a copy in your hand. A lot of that is just all of the editing that you have to go through.
So this will be available at most bookstores. I'm sure it'll be at Chapters.
The Canadian distributor has already sent the volumes to Chapters, so they should have it in their local stores by now.
All right, Biofeedback for the Brain, Dr. Paul Swingle, Ph.D. And, well, let's just say we've obviously got to give a couple of these away today at some point.
I already gave you one.
You did, and I really appreciate it. It's a signed copy, too. I love it. Let's talk a little bit about what you do each and every day, changing people's lives one by one. They come into your clinic, and you don't really know even why they come in there, and rarely do you ask. And after a dozen treatments, sometimes less, people start feeling differently. What are you doing to them that changes their lives in such a way?
Well, the fundamental part of the treatment is normalizing brain activity. The first thing we do when people come in is to have a look at how the brain is functioning. All of our behaviors, problems, symptoms, and so forth are related to brain activity, obviously. And if you can find the area of inefficiency or anomaly in brain functioning and normalize it, then the symptom goes away. It's that simple. We don't have to ask people why they've come to see us because the brain tells us if we see that inefficiency in the way the brain's processing information. Now, for something like alcoholism and addiction, there's one form of addiction, alcoholism, or predisposition to that condition that's associated with a marked deficiency in a particular area of the brain. People just can't shut the brain off. They can't find peace in their own head, and the alcohol replaces what's missing. I think you can think of it in those terms, and they're self-medicating with the alcohol. If we correct that brain condition, then they lose interest in alcohol.
A lot of people ask, how do you read the brain?
The brain produces electricity when it's functioning, and you can break that signal down into various waveforms. For example, delta are brain waves from roughly a half a cycle a second to 2 cycles a second. Theta are brainwaves from 3 to 7 cycles a second. Now, theta is a good example of a general issue associated with brainwave activity. The significance of a brainwave depends on where you find it. So in some areas of the brain, you want to see a lot of theta or slow activity. It represents the brain's ability to quiet itself. That's what experienced meditators are doing when they meditate. They're increasing theta amplitude in a particular area of the brain, which is why they can calm themselves so profoundly. In other areas of the brain, you don't want to see too much theta. For example, if somebody comes in with a traumatic brain injury or stroke, we look around for a lot of theta where it doesn't belong. It represents an area of the brain that's hypoactive and not functioning efficiently. Now, if we find anomalies in theta and bring those anomalies into normal range, then the person can find quiet in their own head, or the stroke person finds recovery of function, and so forth.
How do you measure that activity in a person's brain? Will you hook them up to EKG, is it?
No, it's an electroencephalograph is what it is.
What is the proper acronym for that again?
EEG.
EEG. There we go.
And basically we put a wire on each ear, Now, we don't expect any brain waves coming out of your ears or earlobes, but we use those for reference and grounding. And then the active electrode is put on the head, and we put it over the critical areas. We look at the frontal areas in the brain so that we can look at conditions like predisposition to depression, emotional volatility, ADD. There are areas in the front part of the brain that are associated with certain forms of ADD. We look in the back of the brain to see about quiet and deep and predisposition to addiction and so forth.
So after you've taken this brain map, if you will, you'll be able to tell after doing a couple of ratios, I guess, where a person is either, hyper or hypo, and from there you can work on your treatments. I'm guessing that's how it works.
That's right. Basically, after we do the assessment, then I do some calculations and I sit down with the person and I tell them why they've come to see me. And that can be quite marked. Individuals expect to come in and spend at least a session trying to make me understand why they're there. And in 15 minutes, I'm telling them why they've come to see me. Now, the reason I do that is to really emphasize to the patient, the brain is telling us everything. And the reason that you're having this difficulty is because of an inefficiency or an anomaly in the way the brain's processing information. And if we can bring that into more normal ranges, then your symptoms are going to start to abate. The concept is very similar to going to a gym. If one side of your body is weak relative to the other, your trainer is going to emphasize work on that side of the body to normalize and balance. And if you have imbalances, then you have issues associated with knee problems and all kinds of things because of the imbalance now. So if your trainer can get you balanced, then a lot of those difficulties are going to be minimized.
He's Dr. Paul Swingle from Swingle and Associates in Vancouver. The telephone number is 604-608-0444 for his clinic, 604-608-0444. Swingleandassociates.com is the website. You could find out more. And today's topic is the treatment of alcoholism and other addictions. When do you know that you could be categorized as an alcoholic? Or better yet, how do you know that your alcohol abuse or drug abuse puts you at a health risk? You'll be shocked to find out how little you need to drink to fall into that category. So when are men and women considered at a health risk when it comes to drinking?
The data provided by the National Institute of Alcohol Abuse and Addiction, whatever it's called, the NIMH in the United States, they have reviewed a lot of the data, and it seems that for males, over 14 drinks a week is when you start having health problems. And for females, it's half of that, about 7 drinks a week. Now, there's another issue here. For example, it's not a good idea to have all 14 drinks on Friday night. So having about 3 drinks at any one time is about max. That's in terms of just the straightforward data on health risk. There's the other side of this, and that is, to what extent is alcohol use or your addiction interfering with your life, your job, your family? And those are judgments that the individual has to be able to make. Now, denial, of course, is huge in this arena. I don't have any trouble. Every once in a while I get a little happy. But what is the destructive property associated with that? The other issue is alcoholism a brain disease, or is it an issue associated with moral failing? We've been wrestling with that in our culture for centuries. Some individuals feel that alcoholism is just a bad habit, kind of like picking your nose in public, except, alcoholism is more costly. The other side of this, do you have predispositions that neurologically predispose you to alcoholism? The heritability rate in alcoholism is about 65%, but that can be both physiological and social as well. You're sitting in an environment in which everybody's drinking all the time, you pick up the habit. That may not have anything at all to do with the psychophysiology of it. What we find is that if there are specific deficiencies in the brain, these individuals have a very high probability of being predisposed to addictive behavior, whether it's alcoholism, drug, prescription medication, and so forth. And when we identify that deficiency and we talk to the individual, we find that they admit to these kinds of difficulties, and we can help them by normalizing that brain activity. Now, we have other kinds of issues associated with addiction. Loneliness, The aged very often get into situations in which they have a little nip of sherry to help them sleep kind of thing. And that starts to accelerate. And then they start to isolate. They see fewer friends. Their loneliness increases. You see that in gambling. You see a lot of elderly sitting in front of slot machines in Las Vegas, glued to that machine. And it's the stimulation associated with it. So the mechanism of the addiction varies. Sometimes it's the excitement that the individual is seeking, and other times it's exactly the reverse. They're looking for quiet. How can I shut this brain off?
Going back just a second, Dr. Swingle, to what you consider to be a health risk, though, how many college students or late teens would say that they've had more than 14 drinks in a week? And if you consider a drink being a beer or just a highball or whatever, and 7 for women, that would put a lot of people into that category if they continued on that way.
Absolutely. The number is over 30% in the U.S. are above these levels.
Let's take a call from Candy. Hello, Candy, and welcome to It's All in Your Head.
Thank you very much for taking my question. This is a little bit off topic, but I believe it's related. It's on the topic of sleep apnea, and sleep interruption itself is damaging. Other concerns, though, are the lack of oxygen to the brain. So I'm wondering if your methods can regenerate oxygen-starved cells. Also, if they can indicate the initial problem, if they can actually indicate what's happening to start the whole sleep apnea perpetuation itself.
That's an interesting question. We see a lot of individuals who have some degree of frontal lobe injury associated with oxygen deprivation, everything from birth traumas to cardiac arrest, and, of course, sleep apneas. There are a lot of things that we can do to correct the frontal cortex associated with the effects of oxygen deprivation. What you tend to find there is an elevated slow-frequency activity, and you can arouse the brain with neurotherapy. Sleep apnea, what you need is a sleep assessment done at one of the sleep clinics to determine what the physiological basis for it is, and they use the CAP, of course, in terms of increasing the pressure to correct the sleep apnea. Now, there's another aspect to that, and sometimes what is diagnosed as sleep apnea is really a deficiency in the back of the brain where the individual can't rest, so that their sleep is restless. And the other condition is referred to as nocturnal myoclonus, which is kicking of feet so that you never go into deep wave sleep. So it's important to determine exactly what you're dealing with, and if there are any legacies associated with oxygen deprivation in the frontal part of the brain, yes, it can be corrected, or at least improved.
What about hyperbaric oxygen therapy? Have you ever recommended that to patients or heard about that being used in this case?
A lot of our clients have been through a series of that, and some of them maintain that it's helpful.
Candy, I thank you for your call. We're talking alcoholism and other addictions with Dr. Paul Swingle from Swingle & Associates. They're at 1190 Melville Street in Vancouver, 604-608-0444, 604-608-0444, swingleandassociates.com. The most important thing you want to share is that these kinds of addictions are fixable and there's no need for medication, and it's actually really quite a simple process for you. But I don't think a lot of people, of course, even know about neurotherapy and that these kind of disorders can be treated.
Yes, again, it depends on what type of addiction you're dealing with, and secondarily, what are the fundamental problems in brain activity. There are some areas in which, for example, individuals become addicted or become dependent on alcohol because of social phobia. A lot of us have had that experience. The college kid who finds that if he has a couple of beers before he goes to a party, he feels a lot better and things seem to work for him. Well, he's developing a dependence on alcohol because of a social anxiety. That's a little different than an individual who has a severe deficiency in the back of the brain and they just can't find peace in their own head. They're deficient in some forms of the neurotransmitters that give rise to quiet and feelings of contentment, and the alcohol is replacing that. So we need both neurotherapy to correct the neurology of it, and then we need some social programs or behavioral therapy to correct the other habitual aspects of it. By the way, what's ludomania?
Ludomania?
Yes.
I have no idea.
Gambling.
Oh, really?
Yeah. gambling addiction.
That's the interesting thing about neurotherapy, though, is you're able to distinguish which type of problem it is, whether it's, it's just a social situation, like you said, the teen or the college student that becomes dependent on, or if it's something worse. Larry is on the line. Larry, thanks for joining us. You're on It's All in Your Head with Dr. Paul Swingle.
Hello.
Hi, Larry. Go ahead.
Yes, Dr. Swingle, I've been reading a book by Daniel Amen.
Yes.
And he talks about brain SPECT imaging.
Yes.
And it seems to be similar to your method. What's the difference between his method and your method?
He uses the SPEC, and basically what they do is they look at glucose metabolism. So they inject you and see how the brain is metabolizing. And what we use is the electroencephalograph, in which we are looking at the electrical activity coming from the brain. Amen shows areas of the brain that are not functioning in terms of the metabolism. We can identify areas of the brain that are not functioning within normative limits because we know what the brainwave activity should look like there. Ours is far less intrusive, of course. And in terms of what we do for simple problems like depression and sleep problems and anxiety and so forth, we look at 5 or 6 spots on the brains, the critical ones. For more serious problems like epilepsy, traumatic brain injury, we do a full brain map. Our procedures are far less expensive by a long shot and less invasive.
Hey, Larry, it seems like you like to read. Why don't you get yourself a copy of Biofeedback for the Brain? Now it's out from Dr. Swingle. You can compare the two types of imaging, if you will, and enjoy the book.
Thank you.
Thank you, Larry. Hello, Sandy. Thanks for waiting. You're on with Dr. Paul Swingle. It's all in your head.
Hi there. I was just wondering about anger. Is it a behavioral issue, or would it be a learned behavior, or is it just something that you control with changing some brainwaves?
There are several components associated with anger. One is there's a predisposition to emotional volatility, and that's a disparity in the frontal cortex, quite identifiable. And with males, for example, that volatility is likely to get expressed as aggression, anger. There is a habitual portion to this. If an individual discovers that they can control other individuals by rapidly accelerating to aggressive verbal insults or screaming or that sort of thing, their behavior is being reinforced. So that's a behavioral. The nice thing about neurotherapy is we can look to see what the neurological predispositions are, correct them, and then do behavioral therapy in conjunction with that to correct and extinguish the habit pattern.
Does control and intimidation fall into that same category?
Big time.
Sandy, thanks for your telephone call. We're also going to fire you off a copy of Biofeedback for the Brain, now on shelves at Chapters bookstores. If you listen to this show regularly, if you've heard about neurotherapy, here's your one-stop shop to find out exactly how it works, examples, and the basics of biofeedback, everything you need to know, frequently asked questions, you name it. And it's a good read, and it'll sort of change the way you think about medication and how to fix certain problems. Let's get to a little thing I talked about just a moment ago. What did you call that, another word for gambling?
Ludomania.
Ludomania.
You like that?
Ludomania. Oh, I see. Okay. I thought it was a D.
It is. L-U-D-O.
Oh, okay.
Ludomania.
So when are you 3 times as likely to become a ludomaniac?
Well, adolescents are 3 times more likely to develop problem gambling. The number there is not really important. I think what is important is that we don't tend to think about that, that adolescents are at that level of risk associated with becoming addicted to gambling and other arousal habits, because gambling is associated with a lot of other things. It's associated with trichotillomania, pyromania, kleptomania, and what these are sensation-seeking habits. What we tend to find with gambling is that these individuals are deficient in norepinephrine, so that they need arousal. This is a stimulation addiction. And it's very interesting, some of the work that was done at Harvard Medical School, in which they have a look at the brains of individuals during various phases of gambling. And it's interesting that the gambler gets a high out of loss as much as he gets a high out of winning. So it's interesting when you look at that process. It's correctable with neurotherapy because you can correct the area of the brain associated with that. Now, it's interesting that one of the side effects of the drug that they were using for Parkinson's, Mirapax, I think is the trade name for it, Pramipexole is the actual name. One of the mechanisms of that drug for dealing with Parkinson's is to increase dopamine. It's a dopamine agonist. And one of the side effects of it was that some individuals developed gambling and sexual, I don't know if addiction is the right word, but it became problematic for them.
Interesting. Now, the kleptomania is interesting, too, because you hear a lot of teenagers and kids going through that. And
Yes.
I guess risk or the excitement of possibly getting caught is what we're talking about here.
That's the high.
Wow.
Yes.
Karen, thanks for waiting. You're on with Dr. Paul Swingle. It's all in your head.
Hi, how are you?
Great.
Hi.
Good. I just have a question, actually. It's about mercury.
Mm-hmm.
I have a lot of mercury amalgams, and recently I had taken a blood test, but I know that blood tests are not the most accurate method of finding out mercury that lodges in your tissues.
Mm-hmm.
So I'm just wondering if your method is helpful in finding out the amount of mercury that's actually in our head. I do have 10 amalgams, and there's so many symptoms that I have that you can just literally mark them off from having mercury toxicity.
Mm-hmm.
But I'm having a really hard time convincing, medical doctors that this is the case and that's what's going on. So I'm just wondering if you can be helpful with that.
There are several issues here. The first is you really have to go to somebody who really knows what they're doing in terms of assessing the mercury. There are physicians who have a lot of skill and experience with regard to these sorts of things. And they can do assessments on a wide range of these issues. If you call my clinic, we can let you know of a couple of people in the area who do an excellent job with regard to that. Now, that's one side of it. The other side of it is what is it doing to your brain? And we can determine the effects of toxicities in terms of the impact that it has on the frontal cortex. It will not tell you whether it's mercury or how much mercury that you're dealing with. What it will tell us is there a deficiency in the way the frontal lobes are functioning? And we can correct a lot of that. Now, it may not be mercury. It may be a subclinical viral infection. We run into a lot of that kind of situation. For example, the legacy of Lyme's disease. After it's been treated, there may be a residual problem in the frontal cortex, which we can correct. And there's some things that we recommend in terms of amino acids that can be very helpful in the frontal cortex as well.
Mercury is a big problem, though, and a lot of people are talking about that.
It's huge. A lot of us feel that some of the problems we're having with learning disorder, autism, and so forth with kids is a function of the toxicities in our environment. I've been beating this drum, as you know, for years, and that is we have something in the order of 50,000 chemicals in our environment. The toxicities have never been established.
And isn't there mercury in some vaccines they're finding now?
Yeah, they finally eliminated that. We were trying 10 years ago to get them to be more sensible in the way they do inoculations, but fortunately we're starting to make some headway now.
Let's talk to May. Thanks for waiting as well, May. It's nice having you on the show, and you're on with Dr. Paul Swingle.
Oh, thank you very much for having me. I'm suffering a little bit with depression. I have a lot of anxiety during the day and having sleep problems, and I'm not sure just where to go or what to do or where to pinpoint this problem.
We see a huge number of folks with this kind of condition. What we used to call it in the old days is agitated depression, where an individual has anxiety and depression, and the anxiety often interferes with sleep, and the sleep exacerbates the depression. The way we approach this is have a look at what the neurological predispositions are. There are various forms of depression, and you can spend a lot of time trying various medications that don't touch it because they're trying to treat the wrong kind of depression. Agitated depression, what we usually find is a deficiency in the back of the brain, an imbalance in the frontal part of the brain, and an elevated brainwave that gives rise to emotional dysregulation. Folks with this kind of condition are often vulnerable to addiction, not only alcohol, but prescription medications, addicted to TV, addicted to casinos and sit in front of a slot machine all day because of the arousal and focusing, those kinds of things.
May, the good news is that, this is something that can be fixed, and that the symptoms and this actual issue is really, really simple, as you call it. Tell me a little bit about how you feel during the day, May, and what goes through your mind.
I have trouble making decisions. When I have a decision to make, I get very anxious and sort of this mental wave, as the doctor calls it, goes through my head. I'm trying to address it, trying to do my deep breathing and offset it with avoidance.
Yes.
And the avoidance technique works for the time being, but in the long run, it seems to accelerate the situation.
Sure. Thanks so much for sharing that with us. The kind of behaviors that you're describing are very common. An individual avoids things, and the avoidance gives rise to more serious problems because you're not dealing with problems and they pile up on you. The dysregulation that I was speaking about before, that waveform that's associated with dysregulation, that's exactly what she's referring to in terms of not being able to make a decision, emotional volatility, and so forth.
So, May, I'm going to send you a copy of the book as well, Biofeedback for the Brain by Dr. Paul Swingle. His telephone number at the clinic is 604-608-0444. Jerry's on the line. Thanks for waiting, Jerry. You're on with Dr. Paul Swingle. It's all in your head.
Well, I'm very intrigued by what you've been talking about. I had a bout with shingles. Following that, I have got what they call post-herpetic neuropathy. I'm not sure what they call it, but anyway, I've got a lot of pain, internal pain that they say is strictly damaged nerves from shingles episode. Is there anything to be done about that?
Shingles and post-traumatic, the effects of that.
Mm-hmm. Shingles is a herpes-type viral infection, and there are several things here. Individuals that have these kinds of conditions very often report problems with thinking. They feel just foggy. They don't feel as sharp as they were. So we recommend an amino acid for that in addition to doing some neurotherapy on the front part of the brain to improve cognitive functioning. That's for the cognitive side. For the pain side, there are two areas in the brain that are associated with pain perception. And for individuals that have pain like fibromyalgia pain, arthritic pain, by increasing the particular brainwave, their distress associated with the pain is reduced. So that's the way we approach things like subclinical virals.
Well, another source of pain is fibromyalgia, and Erica has a question regarding fibromyalgia and cervical dystonia. Hi, Erica. Thanks for waiting. You're on with Dr. Paul Swingle.
Hi.
Hi.
I think I have said already what's going on with me. I was on a medication for 9 years, and I got pretty sick and cold turkey, and I developed a tremor quite badly, a lot of muscle spasm. And, of course, from the fibromyalgia, I got a lot of pain.
Yes.
And the tremor is pretty bad.
Mm-hmm.
But it also has a lot to do with I have to stay away from stress, and I just have to keep myself calm. And I can't do very much work. My life has completely changed.
Yes.
And I just wonder, is there anything I probably could handle the fibromyalgia, but the dystonia,
mm-hmm.
I was diagnosed after finally almost 8 years with cervical dystonia.
Yes.
Pretty tough.
Yes. We see a lot of individuals with dystonia. Cervical dystonia is extraordinarily painful.
What is it, just out of curiosity?
That's a spasm of the neck muscles.
Okay.
And that's the one where your head is often pulled to one side and there's a spasm. It's a very painful condition. What we typically find in fibromyalgia is a severe deficiency in the back of the brain and some inefficiencies in the frontal cortex. One part of that is very similar to what you find in addictions. The dystonia tends to be associated with a problem in what's called the sensory motor rhythm, which is over the sensory motor cortex right on top of the head. And we treat that in the same way that we treat epilepsy, by increasing the waveform that quiets the body. The other thing that we often recommend is about 200 milligrams a day of vitamin B6. That very often can help with muscle spasms.
So, Erica, there is help for you, and I'll give you the clinic's number. It's 604-608-0444, 604-608-0444. And Marie wants to know about head injuries as kids. Hi, Marie. Thanks for waiting.
Hello. Yes, if a male child fell into a pit and landed on their head on cement, and then as they're an adult, they seem to be fairly moody all the time, and kind of depressed. So are there tests that can be done and things that can be done? I guess that could maybe cause them to be that way.
Yes, mood dysregulation is a common symptom associated with traumatic brain injury. You got a dysregulation in the frontal part of the brain. It's interesting that no matter how you're hit, the front part of the brain is always implicated in a head injury because of the way the brain sits in the cranial vault. And mood dysregulation and impulse control problems are a very common symptom associated with traumatic brain injury. And it is something that we treat even many years past the accident.
Marie, how old was the boy?
About a year and a half or two, not very old.
So, very young.
Yeah.
And, that happens to a lot of kids, and we just think, they're bumping their head. That's the normal part of being a kid. But when do you know that it's more serious than that?
Yes, the mother.
The mother knows.
The mother knows, and the mother outranks everybody.
I was wondering what kind of tests they could have, and where could they get the tests, and are there things that can be done to rectify?
What we do is we do a brain assessment to see if the frontal lobes are dysregulated. It's a neurological assessment as opposed to a behavioral assessment. The reason that you're coming in for an assessment is you feel that there's a difficulty associated with this condition. And then what we do is we have a look at what the brain is telling us in terms of what the predispositions would be to that in terms of the brain injury.
Marie, we'll send you a copy of the book as well, Biofeedback for the Brain. It explains how the treatment works. And then when the clinic calls you, you can book the child, now adult, I'm assuming, for an appointment at 604-608-0444. That's 604-608-0444. Swingle and Associates, 1190 Melville Street in Vancouver. And you've been there for a long time, and you've had people coming in from all different walks of life with all different conditions. And I'm assuming that after they have that initial brain mapping and you tell them why they might be there, that must be a hugely important stage in the whole thing, to know that you can actually help them.
Well, the brain does tell us everything, and a lot of people find a tremendous relief in that, because a lot of folks have been going to physicians and psychologists and so forth, spending hours trying to explain what's wrong with them. And they have the feeling that the other person doesn't appreciate it or doesn't believe them or feels that they're malingering or whatever. And when they come in after 15 minutes of recording and calculation time and I tell them, why they're sitting there, I've had people break down and start to cry because they don't have to persuade me. Somebody at least understands what the problem is, and then we can talk about what are the possibilities in terms of trying to correct the situation.
Well, not only that, they're not being prescribed medication, which of course is commonplace in regular medicine.
One of the fundamental bases of treatment of these conditions is to sedate it or use some sort of pain medication, as opposed to actually dealing with what the problem is.
We have time maybe for one last phone call here. Hey, Rachel, we appreciate your phone call here to Dr. Paul Swingle.
Oh, hi, Dr. Swingle. I wondered if you could tell me, a 77-year-old woman who's had a couple of small strokes and a lot of health problems, having anxiety a lot, deep depression, and sometimes, and especially in the morning, and try to work out of it. Do you think the strokes have anything to do with the anxiety and depression and that?
Yes, but it may not be for physiological reasons. Anytime we have these kinds of stroke events, ischemic events, we always become vigilant, we become agitated, we become concerned, we become worried, and we become depressed. And that's a reactive condition. There are a lot of things we can do for stroke and a lot of things we can do for depression and anxiety. And we also give the person some psychological assistance, if necessary, for dealing with these thought processes that are giving rise to the difficulty.
So, Rachel, there is certainly hope. The telephone number for the clinic is 604-608-0444, but they'll be calling you to give you a copy of the book as well. You can have a read and see what neurotherapy is all about. It's still an unfamiliar word for a lot of people. They'd never heard about it. I've tried to explain it to people, and it's difficult to explain sometimes because they immediately think of One Flew Over the Cuckoo's Nest and electroshock therapy and not something that's as subtle as what you do.
It is interesting. It is such a simple concept. You find out how the brain is not functioning efficiently, and you do some exercises, for lack of a better metaphor, to strengthen and balance, and the symptoms go away. And once we get it balanced, we can actually do a little optimal performance training so that the brain functions really efficiently.
And you find when you do go to the therapy, it's extremely relaxing. And in the case of the one teenager that went to your clinic, he started looking forward to going. Mm-hmm. And it was always a relaxing experience, and he knew that he was getting better in the area that he was struggling in. And that was really exciting. And test scores, by the way, got much, much better, which is really great news. Well, now that the book's out, we have nothing to talk about for the next 3 minutes. Can't talk about the book anymore. The book's out. Biofeedback for the Brain, Dr. Paul Swingle. If you have any questions about today's show, just call the clinic at 604-608-0444 or visit Dr. Swingle's website, swingleandassociates.com. You could find everything you need at that website. And we thank you very much for listening and calling today.